Hey, I'm Dr. Dino Pappas. Thanks for watching. The views in this video are my views and my views alone. They don't represent the views of any entity or agency that it may be affiliated with. Topic of the vlog today, top 3 exercises for carpal tunnel syndrome. First, let's rewind. The carpal tunnel is an area of the wrist. It's an area that has this little nerve called the median nerve. It passes through a bony row called the carpal area. And there's a bunch of soft tissues, including tendons and ligaments, that run through this tight area called this tight tunnel called the carpal tunnel. This nerve can get aggravated, irritated, or entrapped in the tunnel and produce pretty significant pain in the hand, loss of sensation, and eventually progressively weakness. So this is common in our desk workers that type all day, common in our workers that have repetitive hand use, that use their hands all day long, like our folks in the trades, like our tradesmen. So this injury we're seeing more and more as people focus more on computers, and repetitive hand use becomes more important in our society as well. So here are 3 exercises for carpal tunnel syndrome. The first, it's the median nerve mobilization. So we're going to mobilize this median nerve, this nerve that runs all the way up, from the tip of the fingers all the way up into the neck. So what we're going to do is we're going to keep our head and neck stationary. We're going to slide it just to our opposite side. We're going to tilt our hand this way. And then we're going to floss the nerve. We're going to move that nerve back and forth through the tight groove. So the nerve moves this way towards the head. I'm going to extend the arm, open up the fingers. The nerve is going to slide downwards. And I'm going to floss this like you're flossing your teeth, back and forth. Nerve's moving towards the head. Nerve moves down towards the fingers. And I'm stretching and mobilizing that nerve root one side at a time. I typically recommend repetitions of 20. I'll typically have patients do it between 3 to 4, 3 to 5 times a day. One set of 20, 3 to 4, 3 to 5 times a day. Again, that's median nerve mobilization. The second one is called the pin and strip with a lacrosse ball. Typically, I recommend a golf ball, a tennis ball, and a lacrosse ball. I have patients roll up and down their forearm until they find a tight, tender area. And what I'll have them do is flex and extend that right over that spot. So they're loosening up that tissue of the wrist flexor right as the median nerve passes right through that. Typically, I'll have them find 3 to 5 spots that are really tender, really tight. I'll have them move the wrist up and down about 5 to 10, maybe up to about 15 repetitions per spot. We'll have people do that about 2 to 3 times a day. Again, that's pin and strip using a lacrosse ball, finding a tight area of tension and just mobilizing that spot. Last thing, supination. So a funny way I learned it is if you're holding a can of soup, this is you have soup, this is you don't have soup. This is called pronation. So this is supination, where we're trying to turn the palm upwards towards the ceiling. So we're going to rotate that as much as possible. And what we're trying to do is we're going to extend the wrist, and we're going to grab and rotate this down and through, and we're going to hold this approximately about 1 to 2 minutes. This static stretch of supination and wrist extension, about 2 minutes, about 2 to 3 times a day on the involved side. I'm Dr. Dino Pappas. These are 3 simple exercises for carpal tunnel syndrome. Hey, do me a favor, if you like the content in this video, please hit subscribe. Let's turn on those notifications. Thanks for watching.